Hello friends, today we will be talking about a very common and important problem which we see in our day-to-day practice, which is diabetic neuropathy. So diabetic patients, they suffer from a condition called as diabetic neuropathy, which means that the nerve endings are damaged due to increased blood sugar in diabetics. So this is a very common problem, and about 50% of patients with diabetes, they suffer from this problem. So what are the symptoms? So these symptoms of diabetic neuropathy typically occur in the hands and the feet, just like wearing gloves and stockings. So there are positive symptoms and negative symptoms. So what are the positive symptoms? These include tingling, numbness, shooting, pain, cramping of the calves, restless legs. All these are the positive symptoms. Negative symptoms include loss of sensation, numbness, inability to move, or weakness of muscles of the legs. So, both of these types of symptoms may be present in diabetic neuropathy. And the risk factors include anyone who has diabetes, more the duration of diabetes, more the time period in which sugar has not been controlled, more is the damage to the nerves, and more is the risk of diabetic neuropathy. Now, coming to the treatment part. So, the number one thing in management of diabetic neuropathy is controlling your blood sugar. So, it is very important to have a normal blood sugar so that the damage to the nerves is minimized and helps in reducing the changes that have already occurred in the nerve endings. Secondly, certain types of medication which are not painkillers but which act on the nerves, they are given to control this pain. These include drugs like pregabalin, gabapentin, duloxetine, which you may see are not painkillers, but they work very well. Thirdly, there are certain techniques which we use for stimulating the nerve endings which help in reversal of these changes, including techniques like stimopod and peripheral nerve stimulation. Fourthly, for the muscular pain, we do something called as dry needling or intramuscular stimulation, in which needles similar to acupuncture needles are used to stimulate the calf muscles. They relieve restless leg syndrome and they relieve muscular cramps and pain which may be felt in the calves. The next treatment which we usually do is Botox treatment. In this, injections of botulinum toxin is given at certain points in your feet, which helps in relieving muscular as well as nerve related pain. And lastly, interventional pain management techniques such as lumbar sympathetic plexus block, which blocks certain nerves arising from the spine, which are responsible for the irritation of the nerves in the feet, they are done. And the final treatment, which may be needed if all the previous treatments do not work, is spinal cord stimulator. So, for any such symptoms which you may be experiencing, or if you have any queries and you're a diabetic, write to us in the comment section or you can visit our website. Thank you.